lot of my female subscribers have literally been on my neck about this particular video. When are you going to talk about pregnancy in Ireland? Well, your wish is finally my command. So if you're an immigrant living in Ireland or planning to move here, understanding how pregnancy and childcare work in the healthcare system is very, very important. In today's video, I'll be explaining the journey from discovering you're pregnant to antenatal care, delivery, postpartum support, and the emotional realities of becoming a parent abroad. So if you think today's video is for you, remember to stay glued to your seat. But before then, let me mention this, that today's video is actually going to be a personal one because I'm actually going to use myself as an example most of the time. If you're a midwife, you have a different opinion or suggestion or anything at all, why not just leave it under today's video. Thank you all, and remember to stay tuned. My name is Momo. First step is discovering you are pregnant. Definitely you've done your pregnancy test, you know that you're pregnant. The next thing you have to do is to contact your GP or your family doctor, and then your GP will now refer you to maternity hospital where you want to undergo your entire pregnancy journey. Talking more into this, when you're done discovering that you are pregnant in Ireland, you now have to talk to your GP or go appointment for your GP to actually confirm that you are pregnant. So your GP will usually confirm the pregnancy and then refer you to the maternity hospital where most of your pregnancy care will take place. Ireland has a structured maternity system, and many pregnancy services are provided through the public healthcare, which is actually very free. So after I spoke with my GP and all of that, I had the option to choose where I wanted to undergo my pregnancy journey, and they also asked me which county, whether it's the same county or in Dublin in the city. So I actually chose that was very close to me. The next thing is choosing your maternity care. So in Ireland we have three options. The first one is the public care, which is free maternity care and shared care with your GP and the hospital. And the next one is the semi-private care and the private care. So it all depends on you. Ireland has a maternity care system where many services are free under the public health care. They are totally free. Then the next one is your first hospital appointment. I know it's called booking visits in Ireland. That's your first appointment. That's you're going to receive a letter from the HSE hospital confirming the time and also the date for your first appointment for your scan. You'll do the scan first, and then you also have some blood tests that you have to do. The blood test, you're going to do the full blood count, you do the blood group, and also the rhesus factor. We have syphilis, we have HIV, we have rubella. And after the blood test, then you also have the assessment by a midwife. All of that is included in your first visit. Just to mention a bit about the blood test. If you are a rhesus negative person like myself, I'm rhesus negative, B negative, then they are going to do another blood test for your baby or for your fetus at 16 weeks to check the blood group of your fetus as well. If your fetus is negative, then hallelujah. If they are positive, then you have to take your first anti-D shot at 28 weeks. That is it for the blood group. I just wanted to chip this in before I move on to the next step. So the fourth one is antenatal appointments during pregnancy. During pregnancy, you attend regular antenatal appointments where healthcare professionals monitor both the mother and the baby. So these visits usually include blood pressure checks, blood tests, ultrasound scans, and discussions around your baby's overall development and also your overall health. You have two important scans during your entire pregnancy journey, and I know it's not new to those who already have babies. So the first one is your early dating scan, which is actually the first one I spoke about. Then your anomaly scan around 20 weeks. So anomaly scans to check if the baby has actually developed normally. Apart from that, you also have the regular checkup, which is actually monthly. You also have blood pressure checks, baby growth monitoring, ultrasound scans, dating scans, anomaly scans, which is actually 20 weeks. And then you also have the growth scan, anomaly scan at 20 weeks to check if the total development of the baby. And then you also have the growth scan from 28 weeks. Some hospitals will start from 30 weeks or 32 weeks just to check the baby weight. So now let's look at the appointment throughout the pregnancy. It might be different. It's not specific like that. It might be different depending on the hospital that you actually want to visit, okay? From 10 weeks, you have the booking appointment with the hospital. And then we have 11 to 14 weeks, you have the dating scan. Then 18 weeks, you have your midwife or hospital. Then from 20 to 23 weeks, you have the anomaly scan. So at 24 weeks, you might have to see your GP. And then from 24 to 28 weeks, you have diabetes blood test. That's the fasting test. And then at 28 weeks, you have your midwife or hospital visit. Then at 30 weeks, you have your GP visit. 32 weeks, you have the midwife or hospital. And then at 34 weeks, you have GP. 36 weeks, midwife or hospital. 37 weeks, you have GP. 38 weeks, we have hospital or midwife. And then 39 weeks, we have GP. 40 weeks midwife hospital. That's all with the visit. I just wanted to like chip this in for you to know that it's actually a shared care between the hospital and also the GP. So with myself, I only did the midwife assessment the first week, and then after that it was more of the consultant and then the GP. So it all depends on the hospital. Now let's move on to the next one, which is going to be pregnancy classes, which is actually done via online. I know it might be a bit different from what we are actually used to. In Ireland, many hospitals or clinics offer free or low-cost antenatal classes. It actually covers labor, breathing, breastfeeding, newborn care, and many others. It's actually a great way to prepare and also meet other parents online. Some are online, some might be in person, all depends on the hospital, but mine was more like online. I never actually utilized it because I was actually doing my own learning. So we have like antenatal classes, breastfeeding classes, labor preparation, and a whole lot. So this helps parents understand like labor, delivery, and baby care, especially for like new moms. So the next thing, let's talk about labor and delivery. When labor begins, you usually contact the maternity hospital, and then they will now advise you on when to come in depending on your symptoms. At the hospital, the medical team monitors both the mother and then the baby to ensure that everything progresses safely. So talking about SVD, many women deliver through spontaneous vaginal delivery, which is a natural birth process. Recovery from vaginal birth is often quicker than, let's say, cesarean section or CS. Depending on the situation, mothers may be discharged within 24 to 48 hours. Let's talk a little bit more about the CS. In some cases, a cesarean section may be necessary. This is like a surgical procedure used when a vaginal delivery may not be safe for the mother or baby. The recovery for the cesarean section is usually longer than that of the SVD, okay? So mothers may stay in the hospital for several days while receiving post-operative care. Talking a bit more about the cesarean section, like before you undergo the operation, you are going to meet with your consultants. They are going to allow you to sign some documents, give your consent, take you through the whole process for you to know some of the benefits and also the possible negative outcomes that might actually happen. For you to have all of those things, talk to you about birth control plans. They're going to have a whole session with you for you to feel very confident before you progress into the operation. Now let's talk about after delivery, which is your postnatal care. So we have hospital stay, we have baby checks, we have postnatal appointments, we have public health nurse visits. In Ireland, the public health nurse usually visits your home after birth to check on the baby and also on the mother. They're actually going to do some tests for your baby just to make sure that your baby is fine, does not have any allergy. I remember the heel test. They're going to break the heels to make sure that the baby is fine, check the baby's weight, have their own assessment that they have to do, then subsequent visits as well. Now let's talk about maternity leave. Ireland has structured maternity protections. It's a 28 weeks paid maternity leave plus 16 weeks unpaid maternity leave. So you may qualify for maternity benefits depending on your PRSI. So partners can also apply for paternity leave. In this case, you have 26 weeks paid maternity leave, which is actually from your employer and also the government. If you've been in Ireland for a very short time and you haven't paid your PRSI contribution, which is actually a social welfare contribution, for up to a period of like 10 months, you may not qualify for the PRSI contribution. In that case, you might only get that of your employer depending on your contract. So the government is like almost like 300 euro. During my time, it was 289 euros per week from the government. We receive that every week for 26 weeks. And after that 26 weeks, you can decide if you still want to extend your maternity leave. Once you extend it, you are not going to receive any payment from your employer. The employer is just for 6 weeks plus the government. But if you still want to extend it, then that of your employer will be cut off, but you can still apply and then you'll be receiving that from the government. So now let's talk about after birth support. So support continues after your baby is born. You have to note that the public health nurse visits your home, as I said earlier on. So you have development checks for your baby care, which is actually free. You have breastfeeding support, which is also very available. You have subsequent visits to the public health office, and then they're actually going to send you a message through text message or an email for you to know your appointment date. The public health nurse is actually available throughout this period. The next one is social support. One of the biggest challenges many immigrants face after giving birth abroad is lack of family support. in many cultures, like mothers, sisters, extended families may help take care of the baby and support the new mother during recovery. But when you live in abroad like myself, you may have to navigate this journey mostly with your partner or close friends. Even if you have a close friend making themselves available to help you through this journey, I'm telling you, you have to appreciate them, because it's there forfeiting their overtime or their extra euros or pounds or dollars just to help you out. At this time, it's very, very difficult. So like managing home, sleepless nights, balancing responsibilities, emotional and mental health, like it's no joke. Like motherhood can be beautiful but also emotionally challenging if you don't have the support. So you have all the hormonal changes, sleepless nights, and the responsibility of caring for the newborn sometimes leads to feeling of sadness, loneliness, and anxiety. Like it's not easy having to balance all of this. Talking about it today, I'm just reflecting all the nights that I was crying, I was sad, and all of that. It hasn't been easy at all. Some mothers experience postpartum blues and even postpartum depression, which is why emotional support and communication with the healthcare providers are very important at this stage. So always remember to seek help. So at this stage, I want to say a very big thank you to all my friends, all my family, those that were always available to help emotionally, physically, spiritually. Like I don't take you for granted at all, because it was so difficult. Even me having like 3 experiences already, and this was my 4th pregnancy, it was still not easy at all. I still needed like friends to help, I needed family to help. I had my big sister staying with me here. I had amazing people. Actually, I had so much support, and I'm really, really grateful. Even with that, I still found myself crying sometimes at night. Just imagine you not having support at all. You just have to prepare yourself psychologically. And this country, in particular Ireland, having to bring a family member to support you during this time, it's so discouraging. You have lots of refusal. I had my mother being refused. Can you imagine? Like, and you have to go through the process all over again. I don't take you all for granted. Just take a very big kiss to all those who actually supported me and were available during this tedious time. And then to my partner also, I appreciate you a lot during this time for the support and the care and all of that. Thank you. Let's move on to the next one. Let's talk about childcare benefits. So Ireland provides financial support for children. We have monthly child benefit payments, okay, which is actually 140 euros every month, which actually helps with the basic cost of raising a child. So automatically applied for your child after childbirth. Like, you have to fill some few things, and then that is it. I actually had someone asking me, do I regret having a baby in Ireland? That was actually a very dicey question. People often ask whether I regret having a baby in Ireland. Personally, I would say no. Although being far from family can be difficult at times, the healthcare system and then the level of maternity care available here are generally very supportive. And also having a lot of people around me, I would say, actually helped me through the process. Like any life experience, there are challenges, but there are also many positive aspects. I'm very glad I had my baby. Yes. So let's look at the positive aspects of all of this. So despite the challenges, Ireland provides structured maternity care, trained healthcare professionals, and follow-up support that helps many families navigate the early stages of parenthood. But that of family support is equally needed. For many immigrants, it becomes a journey of resilience, growth, you can't play with that, and building a new life. That is more personal, just like mine. For me, I'll say that the journey had its own challenge, but also many beautiful moments which I don't play with at all. Pregnancy and childbirth are life-changing experiences which you can't underestimate. If you are living in Ireland and expecting a baby, I hope this video helps you understand the process better. If you think this video has been of great help, remember to just click on the like button, leave a comment just to encourage me. Having a baby is a life-changing experience, whether you're at home or you are abroad. And if you have experienced childbirth in Ireland as well, feel free to share your experience or your story in the comment section so that you can help other parents as well in today's video. Remember to like, remember to comment. Please, my subscribers, you guys are not commenting at all. If you think this video has been of great help, don't tell me when you see me, or don't send me a message. No, leave it under today's comments, okay? Leave it under today's video. Also remember to hit the thumbs up. If you do that, YouTube is actually going to suggest a video to a lot of people. So please remember to hit the like button. Remember to just say, girl, you're well done, this video is helpful. Just, encourage your girl to keep doing more. Thank you all so much for always coming through. See you all soon on my next video. Bye.